If you have PCOS and feel like you're doing everything right, but your symptoms keep getting worse, irregular periods, weight that won't move, fatigue, unwanted hair growth, there may be a few everyday habits quietly working against you. Hi, my name is Dr. Basma Faris. I'm a board-certified OBGYN as well as a trained dietitian with an expertise in treating PCOS and insulin resistance. Today, I'm going to walk you through 8 habits that can make your symptoms worse and what the research actually says. Polycystic ovary syndrome, now called PCOS, affects roughly 1 in 8 women. In this video, I will refer to PCOS and PCOS interchangeably for ease, but you should know that the official guidelines have renamed PCOS to PCOS. PCOS or PCOS is driven largely by insulin resistance and higher androgen levels, and those two things feed off each other. Here's the encouraging part. The way you move, eat, sleep, and manage stress directly influences both. Lifestyle is considered first-line management for PCOS, not because it's a consolation prize, but because it actually works. Habit 1 that could be making your PCOS or PCOS worse is being too sedentary or sitting for too long. International PCOS guidelines specifically recommend limiting sedentary time, sitting, screen time, long stretches, sitting at a desk. Replacing that with movement of any intensity, even light movement, provides health benefits. Here's a clinical insight patients find surprising. Exercise improves belly fat and cholesterol numbers even when the scale doesn't move. So if you're walking regularly and the weight isn't budging, you're still improving your metabolic health. Don't stop. Keep it up. Habit 2 is missing your activity target in PCOS or PCOS. There's a real number here, and most people don't know it. For general health and preventing weight gain, the target is at least 150 minutes a week of moderate activity. Brisk walking counts, or 75 minutes of vigorous activity. If your goal is modest weight loss or keeping weight off after you've lost it, that target actually rises to at least 250 minutes a week of moderate activity. So that gap between 150 and 250 minutes is where a lot of frustration lives. If you're aiming to lose weight while doing the minimum, you may be doing everything correctly and still not reaching the dose of activity that your body needs. Habit 3 is skipping strength training. Cardio gets all the attention when it comes to working out, but muscle strengthening work gets skipped often. PCOS or PCOS guidelines recommend muscle strengthening activity on 2 non-consecutive days each week. Muscle is where your body stores and uses glucose, so building it directly improves insulin sensitivity, the core problem in PCOS for most people. Resistance training and higher intensity interval work both improve body composition, and no single type of exercise has proven superior for PCOS. So the best exercise remains the one you'll actually do consistently. Habit 4 is skipping fiber and eating too much sugar. There's a diet pattern in PCOS or PCOS that tends to work against you. Refined carbohydrates, sugary drinks, and low fiber. Eating whole grains and high fiber complex carbohydrates is associated with less insulin resistance, improvement in unwanted hair growth, and better fertility outcomes. Trials of low glycemic index eating shows improvements in insulin resistance and triglycerides. An important nuance: no single macronutrient pattern, low carb, low fat, high protein, has been proven better than the others for PCOS overall. So the goal isn't a perfect diet. It's a sustainable pattern with more fiber and fewer refined carbohydrates. Habit 5 is cycling through fad diets when they're not working for you. You lose 30 pounds, then you regain 35 pounds, you start again. Many of my patients have lived this cycle for years. Since no specific diet outperforms another in PCOS, extremely restrictive plans offer no special advantage, and they carry real risk. Disordered eating is up to 4 times more common in people with PCOS than in the general population. That's a really big number, and it's why eating behaviors deserve genuine attention, not just calorie counting. If food feels like a source of guilt or loss of control, please tell your clinician. That's a medical conversation, not a willpower problem. Habit 6 is eating quickly and not practicing mindful eating. Structure is what separates plans that work from plans that don't. The behavioral strategies with the best evidence are simple: self-monitoring what you eat and how you move, adjusting your environment so the easy choice is the healthy one, eating more slowly, setting specific and realistic goals, and planning ahead for the days you slip, because you will slip. Everyone does. When these pieces are missing, even a good diet plan tends to fall apart. Habit 7 is leaving depression, anxiety, or stress untreated. Depression and anxiety are significantly more common in PCOS. Guidelines recommend screening every patient. This isn't a side issue. Untreated mood symptoms make it much harder to stick with any plan, and unmanaged anxiety and depression can directly undermine PCOS treatment. Treating the mood symptoms often makes the lifestyle changes possible. Habit number 8 is ignoring your sleep. Sleep problems, especially obstructive sleep apnea, are more common in PCOS and are part of the recommended lifelong assessment. Loud snoring, gasping at night, waking unrefreshed, daytime sleepiness. These are all worth mentioning at your next visit. Poor sleep worsens insulin resistance and appetite regulation, so it quietly amplifies every other habit on this list. Meaningful improvement in PCOS comes from consistent, moderate, sustainable changes. One important reminder: this video is general education, not personal medical advice. Your labs, symptoms, medical history, and goals, including whether you're trying to conceive, all change what's right for you. Bring any concerning symptoms or abnormal results to a qualified healthcare professional. Hope you found this helpful. Remember to hit like and subscribe, and I will see you in the next video.